is Dr. Shivani Dixit. Dr. Shivani Dixit. She is going to talk on deregulated notch signaling in the lens capsule of eyes with pseudo-exfoliation syndrome.
Good afternoon. So my presentation is on deregulated notch signaling in lens capsules of eyes with pseudoexfoliation. Pseudoexfoliation syndrome is characterized by abnormal fibrillar deposits in the anterior segment of the eye, especially the lens capsule. It is already established that PXF increases the risk of developing glaucoma, but then not all eyes with these deposits develop elevated IOP. And there is insufficient data on what factors confer the increased risk. There may be some differences at the cellular level which determine whether an eye with PXF will develop glaucoma. And one such cellular level which we can study is signaling pathway. So signaling pathway is the method by which cells communicate with each other to bring about intracellular changes. Notch signaling is one such pathway which was discovered in a fruit fly. It was found that an abnormality in this pathway led to formation of notches in their wings and hence the name notch. The components of the pathway include receptors, ligands, and downstream targets. So the notch receptor is synthesized in the endoplasmic reticulum. It then moves to the cell membrane where it gets activated by the ligand. Now this activated receptor domain then enters the nucleus and activates the target genes. So if we evaluated these multiple components in our study groups, which I will elaborate in the results section later. Talking about the role, it plays a role in the differentiation, cell growth, and apoptosis. Now in the eye, studies have shown that notch signaling regulates the growth and differentiation of lens. There are studies which support that it plays a role in the neuroprotective function of Muller cells of retina as well and supports the survival of retinal ganglion cells. And hence, we chose to study this pathway in glaucomatous eyes. Apart from eye, the notch pathway has been linked to Alzheimer's disease, which, like glaucoma, is a neurodegenerative disease. Pseudoexfoliation has also been associated with Alzheimer's disease, and so we propose the hypothesis that this altered notch signaling in the eye may account for differing phenotypes in pseudoexfoliation. It was a prospective observational study with the purpose to identify the alterations in the expression of notch pathway molecules in the lens capsules of eyes with pseudoexfoliation deposits. We collected anterior lens capsules from 109 patients. 4 groups were studied. There were 29 eyes in the PXF group who had PXF material in their anterior segment with IOP less than 21 and healthy discs. There were 24 eyes in pseudoexfoliation with glaucoma, that is the PXG group. They had PXF material in the anterior segment with IOP more than 21 and glaucomatous disc or visual field changes. 23 eyes in the POAG group, again IOP more than 21, open angles and glaucomatous disc with visual field changes. We had 33 controls who had cataract with IOP less than 21 and healthy discs. Out of the 109 patients, 47 had glaucoma, and among those, 21 eyes underwent cataract surgery, while 26 eyes underwent combined cataract along with trabeculectomy surgery. From the 109 samples collected, 52 of them underwent gene expression profiling using PCR. So here we determined the total amount of mRNA in these molecules in the 4 different groups and compared them to each other. The remaining 57 samples underwent protein expression just to confirm the overactivity of this pathway. It was done through immunostaining and dot blot analysis. Our data was analyzed using the ANOVA test. The demographic data here shows that all our 4 groups were well matched for age, axial length, and central corneal thickness. On comparing the 2 glaucoma groups, we found that the PXG group had a statistically significant higher mean IOP and advanced glaucoma in terms of worse mean deviation and thinner RNFL when compared to the POAG group. Now, before I describe the actual results, I will just brief about the components of the pathway. So there are 2 main types of ligands, delta-like and jagged. And this graph is showing the expression of ligands in the 4 groups. The light green bar here is denoting the PXF group. And as we can see, the delta 3 and delta 4 ligands were significantly elevated in the PXF group. There are 4 subtypes of notch receptors in the notch pathway. And we found that there was statistically significant expression of notch 4 receptor in the PXF group again. Similarly, downstream targets like HES3 and HE1 were significantly elevated in the PXF lens capsules. This slide is showing the immunostaining of lens capsule in the different groups, and as being marked here, there was increased Notch4 receptor staining in the PXF lens capsules. So by now, both RNA and protein studies have had confirmed the increased expression of these molecules of Notch pathway in the PXF eyes. To summarize, the PXF eyes showed increased expression of delta-like ligands, Notch4 receptors, and certain downstream targets. To conclude that Notch signaling is highly activated in the lens capsules of eyes with pseudoexfoliation, but not in pseudoexfoliation glaucoma or primary open-angle glaucoma. This deregulated Notch signaling may protect the eyes with pseudoexfoliation from developing glaucoma. Now, this is a novel finding, and we need further studies to elucidate the intricacies of this signaling pathway in other ocular tissues with pseudoexfoliation, like trabecular meshwork and iris. Thank you.
Very well presented.
Thank you.
You had how many number of patients you said?
Ma'am, 109 eyes.
109. So you had classified them as only pseudo-exfoliated patients were chosen, whose anterior capsules were then collected.
Ma'am, as I had mentioned in the criteria, we had the eyes which have pseudo-exfoliation material but IOP less than 21 and healthy discs, no visual field changes, they were in the PXF group. On the other hand, the eyes which had that pseudo-exfoliation material in their anterior segment along with high IOP and disc changes and corresponding visual field changes, we categorized them into the pseudoexfoliation glaucoma group. Like that.
How do you apply this finding to the clinical realm? How do you use your study clinically?
Ma'am, we had the EMR number of the patient, they were sent for the processing, and after that we tallied that, okay, these are the findings, and when we checked back, then this was the diagnosis and we knew that.
No. What is the clinical relevance of this Notch finding with the
yes, sir.
cases?
So, sir, if we can come up with a potential drug therapy which can step up or cause overactivity of the signaling pathway, we can look forward to some treatment of such eyes and can stop them from progressing into pseudoexfoliation glaucoma. As this Notch pathway is already being studied for treatment of Alzheimer's disease, so we can get a potential drug target for that.